Hi, I'm Nicholas with Nightingale College, and this is my skills assessment video on inserting a catheter using a sterile environment. To begin, my supplies are my patient. I have here my hand sanitizer, my cleaning supplies here, these 2 towels, have my gloves, I also have my trash bag and my sterile catheter bag. As you can see, I'm wearing my Nightingale attire. I have my Nightingale uniform on, and I have no jewelry on. So to begin, I'm going to knock on my patient's door, I'm going to enter the room, and I'm going to close the curtain behind me for patient privacy. And then I'm going to introduce myself to the patient. Hi, I'm Nicholas. I'm going to be inserting a catheter here for you today. Can you please tell me your name and your birthday? All right, thank you. After confirming the patient's name and birthday, I'm going to then look at their wristband. Okay, I've looked at the wristband. All right, so as I mentioned, the doctor ordered a Foley catheter for you, and I'm here to insert that. So to do so, I'm gonna place you in your bed and get you into the proper position, and then I'm gonna pull your gown up and go ahead and begin to clean the area before I even start to insert the catheter. Do you have any questions about that procedure? No, if at any time you feel uncomfortable about this, please stop, let me know, and we can go ahead and adjust accordingly. All right, so I'm just gonna go ahead and put on my hand sanitizer here, and I'm going to put my gloves on. And I got my gloves on. So what I'm gonna do is I'm gonna lay you flat, and what you're gonna do is you're going to put your legs up on the bed here with your knees up, and they're facing outward, and then I'm gonna spread your legs a little bit, and then from there, I'm going to go ahead and lift your gown up. All right, so you're in the proper position. I'll go ahead and put your gown up here. So I have two towels here. One of them has a no rinse soap on it. It's a damp towel with the no rinse soap, and I'm going to begin by cleaning you. All right, it's gonna be a little cold for you, but here we go. I'm gonna start on the outermost part of my patient, working away from me, and then I'm going to start on the innermost. And actually, I'm going to switch, before I start on the inner, I'm gonna switch part of the towel. And then I'm going to switch part of the towel again. I'm going to clean down the middle of the perineal area. Okay, and I'm going to discard. And I'm only going to do that with one hand. I accidentally may have touched there, but in actual practice, I'm only going to do it with one hand to not break the cleanliness there. So then I'm going to take my next cloth, and I'm going to dry the patient, starting on the outside away from me, working down, switch sides, working down, and then coming down the middle here. And I'm going to go ahead and find the urinary meatus for the patient. Okay, after the patient's been dry, I'm going to, in my trash bag here, I'm going to go ahead and toss my supplies there. And I'm going to begin to unwrap the catheter kit. So I'm going to go ahead and take off my gloves here. And I'm going to go ahead and put on some hand sanitizer. And I'm going to go ahead and begin the sterile portion of the kit. So before I begin this here, Miss, I need you to try and lay as still as possible and try not to touch any of my supplies here. I don't want to break the sterile environment here for you. So I'm gonna go ahead and take out my sterile catheter kit. I'm going to lay this on a flat, dry surface, unfolding. All right. Then I'm going to, if I were on an actual big surface, I would have my hand sanitizer elsewhere. I'm just sliding out the way for the sake of space here and for the sake of the video. But I'm going to then take 2 fingers here, and I'm going to lay down my gloves. I'm going to open them, and without touching the gloves, I'm going to begin to put them on. Now I'm going to lift from the paper. I'm going to lift the other side right here without touching the gloves. I'm going to take 2 fingers, and I'm going to grab the inside of this glove, and I'm going to work my hand in and shimmy my hand, working around the knuckles without touching the outer part of the glove. Then I'm going to take my 4 fingers here, reach in through the cuff, and I'm going to slide this hand in and I'm going to close there. Now, with my sterile gloves, I'm going to go ahead and now I'm going to place this drape over you, okay? So to begin to do so, I'm gonna go ahead and take this drape here, and I'm going to place it under the bottom of the patient. You're just gonna have to lift up a little bit. Got that under there. Then I'm going to go ahead and put this part of the drape over the top with just the perineal area exposed. All right, so we got that part exposed there. Now, are you still comfortable, miss? All right, so the next part, what I'm going to do is I'm going to go ahead and clean you using the alcohol swabs that are located in my kit. But before then, I'm just gonna get my kit ready here, placing the sterile kit, maintaining the sterile environment here. I have my alcohol swabs that I'll be using to clean you. I have a little bit of my lubricant, and I have my catheter here. So I'm gonna go ahead and take my alcohol swabs and have them ready for the cleaning. Then I'm going to take the syringe, and I'm going to place the syringe on the end of the catheter. Then I'm going to take off this end of the catheter, and I'm going to place it into the loop here. And my catheter kit is sterile and have a little bit of my lube there. Going to discard the lube into the trash there. Going to take off the end of the catheter. I'm going to place it into the lube there so that it can be lubed prior to cleaning the patient. And toss that into my trash bag there. Now, with my non-dominant hand, I'm going to begin to spread the patient, and I'm going to go ahead and use the alcohol swab to clean. I'm going to start on the outside, so I'll go ahead and spread the labia of the patient with this left side, with my left hand, and then with my right hand, I'm going to take my alcohol swab, one swab beginning on the outside, and I'm going to toss that one out. Another swab beginning on the side closer to me. I'm going to toss that out. Then the last swab, I'm going to go ahead and come down the middle here. Now, I'm going to have my non-dominant hand. It's going to spread the patient's labia, exposing the meatus, and I'm going to begin insertion of the catheter. With that, I'm going to be using my dominant hand, holding it about 2 to 3 inches from the tip of the catheter. And I'm going to go ahead and grasp it and begin the insertion. And I'm going to ask the patient, are you feeling comfortable? Okay, if there's any pain or any discomfort, please let me know and I can slow down. I'm going to take the catheter here. I'm going to begin the insertion. Okay. Gone in there. Now I'm going to go ahead and leave my non-dominant hand on the patient, and I'm going to begin the inflation of the catheter. All right, then I'm going to see if I can pull back. Okay, there's resistance. I began to get urine, and that's prior to inflation. I got some urine, and now I have resistance, and then we're done there. So from there, I can go ahead and disconnect the tube here, and I can go ahead and begin to clean up. So I'm going to tape the part of the catheter into the patient's left thigh to maintain it right there, and I'm going to put this bag hanging it from the bed and not from the railing. So I'm going to go ahead and hang this from the bed, and so we are finished with the sterile part of the technique. And so I'm gonna hang this off the edge of the patient's bed here, not using the bed railing, to make sure that it doesn't get altered there. And then I'm gonna begin to clean up. So I'll go ahead and wouldn't have removed my gloves. I would have went ahead and taken off the patient's, take that off there, and I'm gonna go ahead and clean up and put everything into the trash here. And once I am done putting everything into my trash can, go ahead and take off the gloves. And I'll go ahead and make sure that the call light is near the patient and let her know that if there's anything that she needs, actually I'll cover her back up and let her know if there's anything she needs. She has the call light, she can go ahead and reach me, and I'm gonna go ahead and document at the nurse's station.